Hello, I'm Dr. Mao. Welcome to the weekly Dollar Wellness COVID update. Along with my colleagues, we will give you the latest development in COVID 19 and some practical advice to help keep you healthy. Today, we're going to talk about different masks and how they offer protection for you in a minute. It's back to school time, but however, several universities, including University of North Carolina at Chapel Hill and Notre Dame, have canceled in-person classes after outbreaks of over 150 cases on campus during the first week of school. The latest stats: the U.S. is recording 49,000 daily new cases on average over the last week, a 17% decrease from the average 2 weeks ago. The U.S. has now recorded over 5,400,000 confirmed cases and over 171,000 deaths. We're seeing significant declines in new cases from peaks in July. However, daily new deaths remain steady at over 1,000 per day for the last 2 weeks. Despite the decline in new cases for the country as a whole, new deaths are likely to remain steady over the next 2 to 3 week period. At the onset of COVID-19, U.S. public officials wavered on the recommendation of public arming themselves with PPE or personal protection equipment such as wearing masks to both protect and prevent community spread of the coronavirus. But since then, it has been definitively confirmed that wearing masks is the single most effective way to prevent both catching and spreading the virus, besides washing your hands and social distancing. Transmission by surface contact is now considered very low likelihood, so stop obsessing over the grocery and food delivery bags and counters in public places. But of course, stop putting your purse or backpack on the floor and do take off your shoes before entering your house. Looking back, the science had always been solid around wearing a mask. The reason why it wasn't recommended was the fact that the U.S. was in short supply of masks, and there was a fear that if everyone wore a mask, that healthcare workers would not have access to them. Well, that was a genuine concern. And in fact, the exact thing happened in hospitals and clinics across the country where frontline workers could not get masks and many had to reuse what they did have, which was not safe. How the U.S. was caught flat-footed is, well, for another story. Today I want to talk about the different types of masks and how to wear them properly, and then explore the effectiveness of their mask in protecting you and others from the coronavirus. First, though, it's important to wear masks properly with as tight of a seal as possible. So that means a nose wire and snug fit around your face. And how you put on and remove your mask will also affect the outcome of the protectiveness. Do not touch the surface of your mask and then touch your nose. That simply defeats the purpose. Wash your hands before and after removing the mask. Okay, let's get to the types of mask. Here is the first type of face covering: a bandana or neck gaiter. They are single layered and, well, doesn't prevent transmission of aerosol droplets. Does not have tight seal around your nose. Not useful in preventing disease transmission, but slightly better than nothing at all. Here is a second type of face covering: homemade cloth mask. Depending on the fabric and layers of material, which should be a minimum of 3, can reduce wearer from spreading droplets, but not as effective in preventing catching from others. Third type is disposable mask with 3 layers of polypropylene. Decent protection for both wearer and others. Cannot be reused, toss after use, and don't forget to mold the nose ring around. Fourth type is the N95, which is the best type of protection. It's 5 layers of material filter out 95%, therefore called N95, of droplets and viral particles. It needs to have a NIOSH approval and registration number on the mask. NIOSH stands for National Institute for Occupational Safety and Health. You need to have a proper fit and seal. Now, this one comes with a respirator, which, by the way, protects you and makes it easier for you to breathe out, but it doesn't protect others as you exhale your droplets. It's expensive, but offers you the best protection. And messes up your hair, by the way, putting on and off. An alternative to the N95 is the KN95, the Chinese version of the N95 that still has to be approved by the FDA. It has similar construction as the N95, a tight seal, and offers comparable protection against viral transmission, and of course, more accessible. However, many unscrupulous manufacturers have gotten into the game during this time, and the masks are of shoddy quality. So make sure you buy from a reputable source. There you have it, all the different kinds of mask protection for you and your family. For more information on masks and other types of protective gear, I invite you to visit taostar.com. That's spelled T-A-O star.com. Until next week, please be safe by wearing your mask in public, washing your hands often, and take care of your loved ones by taking good care of yourself.